today I have a guest. And Greta, do you want to introduce yourself to everybody?
Yeah, hi. My name is Greta. I actually work a little bit with Jenny
Mm-hmm.
as a skills worker. So I work with ARMS and CTSS clients, and we'll talk a little bit more about like what those actually are. But yeah, that's what I do.
So, do you want to explain what the differences between ARMS and CTSS is and like what they stand for?
Yeah, so ARMS is let's see if I can remember the acronym here. It's Adult Rehabilitative Mental Health Services.
Mm-hmm.
And then CTSS is, let's see, child, or let's put a pause on this for a second.
It's all
Edit
right.
here. Let's see, child therapeutic, CT support services. Is that
Mm-hmm.
am I is that right?
Yeah.
Child therapeutic
I
okay.
always mess up that acronym. It's so long.
Okay. I'll just start over with that spiel. Okay. Um, so ARMS stands for Adult Rehabilitative Mental Health Services. And those are for individuals, skills work for individuals who are above the, adulthood, so 18. And anyone below 18 will receive skills work in the form of CTSS or Child Therapeutic Support Services.
Mm-hmm.
Um, and so I guess as a skills worker, I'm usually working with both adults and children in a skills environment. And skills is, and we'll probably get more into this, but skills is a little different from just your typical therapy, right? Degree qualification is a little different, experience level is a little different. Of course, anyone, any therapist, any licensed therapist or anything can still do skills. But it's a really great kind of introduction into kind of testing out whether that career field is right for you.
Absolutely.
Um, yeah, focusing more on like the behavioral components of somebody, not necessarily their emotional side. So you're working with them on things you can see that are observable to the outside eye.
Mm-hmm. So, what qualifications does somebody have to be a CTSS worker?
Yeah, so to be a skills worker, and I don't know what this is. Kind of every state is a little different,
Yeah,
but
it is. It is. And
yeah.
they call it
um,
different things too. So
oh, I know.
most commonly it's just called like a skills worker. Are you a skills worker for an adult or a skills worker for a kid is usually what a lot of people just kind of break it down to rather than having those like long acronym names.
Yeah. Um, which makes it that much more confusing. But generally, you'll need a bachelor's degree, preferably one in psychology. I know that's a requirement for quite a few states. And then, most importantly, experience. So, not only with your degree, but you're going to want to have personal experience, be it education, volunteer work, pretty much anything that involves working with the community and working with other people. Um, it's a little different when you're working as a skills worker because it's so behavioral, right? So that interaction, the understanding of human interaction is super important for working with individuals properly. So just being and getting that education, right, just on paper is not the same as like having experience. So, yeah.
Absolutely. Yeah. And maybe it would be also good if we clarified. So for you to qualify, so if a client were to come in, right, to a community mental health area or a center and want a skills worker, they have to have a diagnostic assessment done by a therapist and then it's recommended and they have to have what's called a severe and persistent mental illness, which includes like schizophrenia, borderline personality
Correct.
disorder, major
Yeah.
depressive disorder, those types of things. And
Yeah.
then
So it's
yeah, and then
I
we
can't just
refer.
yeah. So like I can't just walk up to someone can't just walk up to me and be like, "Oh, hey, I want skills work." Like it's a little more of a process than that, obviously. So like
Right.
I should mention too, like as a skills worker, right? Like I'm working with the client's therapist. I'm working with their caseworkers. I'm kind of facilitating all these things and organizing it. And then when I meet the client, that's kind of where the magic happens. So yeah.
So you do both. You do ARMS and you do CTSS.
Yes, correct.
S-
I do both.
So what
Mostly
clarifies
CT.
what what makes you able to do both?
That's a really good question. I would say I have more experience with just younger clients in general. Just working with them both behaviorally, and then I don't know. I also just I like crabby kids. I think they're funny. Um, but with adults, I think being the oldest child, I was around a lot of adults for a very long time, and I think sort of understanding that world and things like that, and a lot of the pressure from older people too. I had a lot of older neighbors in my life,
Mm.
and like talking with them, and they would, as a kid, I'd go to drop their mail off, and then it would be 2 hours later I would finally get to leave because they would just be talking.
Yeah.
Um,
Yep.
so I think that that ability to kind of flip flop between both is mostly just from experience, I'd say.
Right.
Um, yeah,
What about qualifications? Like, so you said bachelor's in psychology usually for CTSS. Is there a difference for arms?
there isn't. No, you can, at least where we are. That's pretty much. I think that qualification applies overall for skills work,
Mm-hmm.
in general, not just typically if you can work CTSS, you can work arms. It kind of, I guess the best way to explain it is like, legally, right? Like if you can work with a child under the age of 18, there's it should be a lot easier to work with adult who can consent to things on their own, right? So typically that qualification will shift over. I haven't heard of anyone who can work with arms and not
Right.
CTSS or likewise. So yeah.
Right. So are you currently in college? Do you have a bachelor's degree? What does that look like for you?
Yeah. So I actually graduated just this last year, um, psychology, or I double majored in psychology and studio art. Um,
Nice.
and I did a lot of other stuff too, but um, so I think a lot of like different experiences that I had in school and everything for education was really awesome. I had a lot of
Mm-hmm.
amazing professors and guidance and things. And then right now, I'm actually in the process of interviewing for a bunch of different grad schools to get my master's in counseling
Mm-hmm.
and then hopefully get my PhD. But that won't be for a while.
Yeah.
So
Right.
one step at a time.
So, funny story. When I went and got my master's in counseling, I didn't even know what a skills worker was until that point. So, I'm really curious for you, as embarrassing as that might be for me to
Yeah.
admit, I'm really curious then for you. How did you even learn about skills work? Like, that
So
was even a job that you could do.
yeah. So kind of funny story. It actually started in I was taking a psychobiology of sleep class,
Very
which
cool.
that name on its own is like super intimidating. So as you can imagine, we started out with 15 students
Hmm.
and it dropped down to 8
Wow. Was it
by the
hard?
end of it. Yes. That professor, I absolutely love him. He's just love of my life for education, I swear. But
Okay.
so me and my current roommate, um, we sat next to each other the entire class. And at the end of the year, like when we had graduated, we were looking for roommates, right? And she posted, the thing on Facebook, and I didn't even realize she was the person sitting next to me that entire time
Hmm.
because we just like never exchanged names.
Okay.
And then I started talking to her, and like we're roommates now, right? And she's like, "Oh yeah, I work at Hoffman." And I was
Hmm.
like, "What is that?" "I do skills work." And I was like, "Oh, what is that?" And of course, with skills work comes like, "Oh my gosh, like there's just all these different things that we do, and we're not quite therapists, but we work behaviorally," and was kind of explaining it. And I was like, "Wait, so you don't need to, like, you can just start kind of doing like this internship thing like
Hmm.
towards a degree almost?" And she was like, "Yeah, like you don't need to have your LPC C or whatever. Like, you don't need
You
to
don't have to
have
be a
those. Like,
licensed therapist.
right. And so I was just in total shock. And so for me to discover doing skills work right now, it like it wouldn't have happened unless we sat in that class and she didn't drop out. And she almost dropped out of that class too.
Oh, really?
So yeah, just complete accident, but
Wow.
great.
So I think that's just so interesting. I mean, that tells me that like even myself and yourself didn't even know that skills was a thing. And I think
Yeah.
that like we could have a whole separate discussion on this, and that's not what today is about. But I do think it brings up like a really interesting like social like society issue that like people don't know
Yes.
that skills is available to the community. You know what I mean?
Right.
And it's such a
Right.
good tool for a lot of people.
Yeah. Yeah. It's honestly kind of shocking. Like, I mean, I will even say for like some of my clients, right? Like, they've done therapy
Hmm.
forever.
Oh yeah,
And
I'm sure.
for like a few of my CTSS clients, one in particular was just burnt out. Like, they had been doing it since they were, I don't know, 10.
Hmm.
They're like 19 now. And so, or they're almost 19. So I guess they'll be shifting to arms soon. Um, but during that, they were completely burnt out. And so at this point, you know, their parent and I and we're talking about like, well, maybe it's possible to just do skills and not, and move out of that therapy process.
Yep.
And the amount of change, right, of still having that accountability of somebody, even if it's biweekly, checking up on you and creating goals and things like that, that aren't just, emotionally like there's, it all connects, but, focusing just on that person coming to you, right? And working with you in different ways, but not necessarily having so much pressure. Like, that build of independence is just amazing to watch. So yeah, props
Yeah,
to skills. I wish people knew more about it because it's great.
absolutely. And I know even for myself as a therapist, like when I'm like, okay, so you meet, this SPMI criteria, and, I
Right.
think based on your symptoms, you would be a good candidate for skills work. And they're like, well, what the hell is that? Right? Like,
Yeah.
and so
Yeah.
that's, that just shows me that a lot of people in even just our community doesn't know what it is. Um, so before, we talk more about skills work, I kind of want to
Yeah.
go back to that class that you had because that just sounds so interesting. What did you even learn? Like, what are some things that
Oh,
you like learned or had to do in that class?
so let me just tell you, this professor that I had,
Mm-hmm.
I didn't know he was retiring. This was his last year.
Oh no.
And so I took as many classes with him as I could.
Mm-hmm.
And everyone complained about him because he made things so hard. But it was the most rewarding, like, most rewarding classes that I've ever taken from him. So I took psychobiology of sleep, and then I took animal cognition, which is like the 400 level class they offered.
Mm-hmm.
And um because our levels are where I went, the levels were kind of weird. Like, I know some split him. It's a whole thing, but um so for that class, it was pretty much all research based. Like, we had all kinds of neuroscience related papers and literature reviews and meta analyses. We had to write this meta
Wow.
analysis paper that I you know I did very well, and I spent a lot of time talking with him trying to like decode all this stuff.
Mm-hmm.
And we learned pretty much, we started out with kind of the basic, limbic structure and things like that. Um, which for most psych majors, like, we get primed from that, from just basic psychology class and all that kind of stuff. So that wasn't too bad. But so we started going in more to like sleep and social issues too. So the socioeconomic impact on sleep, which is something I never even considered, of like living in cities and how that affects sleep, and how it places, people in disadvantaged areas, right, to have lower like grades and performance
Mm-hmm.
levels because they can't recharge. um and like all, oxidative stress and all this stuff. And for our final paper, he said, well, we can pick any topic we want relating to sleep,
Hmm.
literally anything, but we need to kind of make our own meta-analysis on it, right? Like we have to make our own paper on it and prove all of our evidence and everything. And so I was really interested in bipolar disorder. Um,
Yeah.
I still am extremely interested in it. And um, I also was learning a little bit more about sodium channel blockers and like, the sodium potassium pump. And I kind of stumbled across this one paper that was on, pregbolin, lamictal or lamotrigine is what it's typically called, are pretty commonly prescribed to people for bipolar disorder. And not just epilepsy, because anti-epileptics or anticonvulsants, they're the same name for the same thing, but um, they've been prescribed a lot more for them, and it doesn't really make sense because they're not an antipsychotic medication. They're basically just regulating sodium channels. That's all it is. So I was interested in like how does bipolar disorder and those medications, does that impact sleep, and like is that a part of the benefit of why they work? Um and so of course, as you can imagine, right, like we're talking about like a really small like mechanism
Hmm.
of like specific, like we're talking like how much potassium goes into this sodium pump, and like how does that change, and then how does that connect to um areas of the brain such as like, this is a fun one, the suprachiasmatic nucleus, um
Okay.
which is like a crazy word, but essentially it's like kind of in the brain where things like during the day you build up adenosine, and that's what makes you sleepy.
Hmm.
So when you sleep, you release adenosine, and so the super, I'm just going to call it the super, builds houses all that adenosine, and it was just really interesting to learn how like those sodium channel blockers basically regulate that adenosine buildup, because individuals with both epilepsy actually and bipolar disorder have
Hmm.
issues with regulating that adenosine buildup, which is
Okay.
why in mania someone could stay up for like 2 weeks straight, right?
Right. Or that
Um,
4 days if it's bipolar too.
right, or they just sleep forever. Yeah. So I don't know. It was just
So what about
that.
like people with hypersomnia? You know what I mean? Like they're always just tired, fatigued. What is that
Yeah,
body? Do you know what, just
yeah.
out of
So
curiosity?
sure. So the mechanism for that is actually quite interesting. You can kind of, I guess, learn from it is it's kind of like the equivalent of when you go to a different country and you have issues adjusting to that time,
Hmm.
right? Um, say you're going from here to Australia, right? The time zone's different. So you're tired when it's sunny, and there's this opposite pattern that happens, or people who work night shifts, for example, who kind of have this opposite sleep schedule, right? And a lot of that comes down to just basic patterns over time. So you could start slipping into a rhythm of like, oh, I'm going to extend my sleep by 30 minutes, oh, I won't go to bed for another 30 minutes, right?
Hmm.
And then it'll keep sort of pushing up. And so you get past a point, where you keep pushing off that sleep, and you build up so much adenosine
Wow. Okay.
that you basically, your body is attempting to recover and recover and recover. And in fact, they've done a lot of research on this, especially with teens, because they're, with hormones and everything, right? Their body clock is really not ready to go to sleep until like 11:30 midnight. Like
Hmm.
that's just how they're, you know what I mean? Like that's just what's happening. So for them to wake up super early, right? They haven't released all that adenosine yet. So they still have a bunch that is built up that they haven't been able to release and get enough
Hmm.
sleep. So they're tired the entire week. And then the weekend comes, and what do? They just sleep all the time.
Yeah.
Right? Because they have so much sleep debt. I think that's a common term most people hear, that's
Absolutely.
built up. So in terms of like that hypersomnia thing, um, most of the time, at least from my limited experience slash education, I think most of that has to do with not having enough of an established routine.
Mm.
and over time just kind of allowing yourself, not, you really have to fight it to get to sort of a regulated state. Um,
Well, I mean,
is
just think about all the times that, we hear in trauma work or like
right.
any kind of therapist or healer person is going to say, if your body needs sleep, do it. Take it. Take the
Right.
rest. Your body is telling you need rest. And I think that goes into exactly what you're talking about right now. The research tells us, like, literally, our body
Yeah.
is telling us, hey, you need to sleep. Stop fighting through it.
Yeah. And it's especially true for those, not only with PTSD, because your brain's trying to recover. Right,
Mm-hmm.
there's so much trauma, like especially people like after you're done crying, and I'm sure you've seen this too, and
I've
probably
experienced it
well, well,
myself.
yeah, right, it's like you're done crying and you're out, like
Yep.
your brain is just tapped out. It's used so much like energy potential, you know, it's tapped out. And so, it's true for trauma patients. It's especially true for drug addicts as well, like ex drug addicts coming off, like, say, even, I'm talking like even 9 months after, just like
Mm.
having to take naps constantly because their body just, it's going to take so long to even recover. Um, yeah. And then it's
Okay.
hard to,
Wow. I didn't even think of that in terms of substance use. That's good to
yeah,
know.
there's so many different components of sleep and recovery. But then you get, into oversleeping, which isn't a whole other topic, but
Yeah, and that's that hypersomnia. So wow, okay. Like that is so fascinating, amazing. I think that's like this class that you're talking about is going to take you really far into your grad school and even when you hopefully get to that PhD level. So
yeah,
I'm serious, dead serious.
I thought about, especially when I get more into research, I thought a lot about doing sleep research.
Mhm.
Because in our animal cognition course that was another really hard class. It was interesting too, just looking at like other animals' sleep cycles, right? And trying to kind of make sense of like, well, what makes us different from other species, and like, why do we need this certain ways, and why don't we, and why have we evolved this way? And that also makes it easier to kind of comprehend, like, oh, like this is why we need to do things this way in comparison
Right.
to like another animal or something. So yeah,
Right.
definitely interested in it for the future.
Yeah, and I will say like as a therapist, like it's going to take you so far to working with your people. And I'm sure it has in your own skills work. So,
Oh, for sure.
I'm just surprised how much that class that you're talking about, it sounds so much like a master's level class for it to be like a bachelor's. I'm just like, wow. Like I am sure that's why it challenged you so much and why so many people dropped out is it's so research based. It's
Yeah.
so statistics based.
Hmm. Well, and he had worked at Medtronic for years
Mm,
doing like neuroscience
wow.
surgery with, I guess, a bunch of other people. And so his experience with the brain is just super intense. And I think because this was his last year, he had kind of explained to me, like, he's like, I want to leave my students with like the best preparedness possible. And so I think I didn't know it was his last year, but now, like, looking back on it, I'm like, that's probably why he was so hard on everybody, right? Because he wanted to give it his all. So,
Yeah, I hear you.
class, great class.
That's awesome. So, yeah, let's put this on pause and let's go now into the skills kind of
Sure.
worker side of things. So really what I'd be curious about is, we talked about what is skills work. We've talked about like how you learned about it, which was kind of through like a friend.
Right.
Um, so could you tell, everybody like what a typical day looks like for you?
Yeah. So I guess in terms of like a typical day, I let's see. I usually, wake up, work out, whatever, get my day ready, right? Um, and I'll usually drive to my first client. Um, and I guess before on my drive there, I kind of give myself like a mental recap rundown of like, all right, what did we do last week? What are their goals? what's something maybe we can work on, right? Kind of have a general plan. Um, and as soon as I walk in the house of pretty much any client,
Mhm.
most of the time I have to reassess that plan and make a
Okay.
new one. Because, their home environment could be like the amount of commotion that's happening that day, their mood, it's not always predictable, right?
Mhm.
I don't think anyone's fully predictable. I think that's pretty common. But yeah, so then I'll usually go in and like say, we have this certain objective that we have on their treatment plan, right? And we usually have a couple. So, if it's like, well, let's try and do two, it might end up only being one. And it might be a struggle,
Mhm.
right? But then like other days, it's not so hard and you can do more. So I think pretty much every day when I go to that first client or second client or third client, right? Um, it kind of just varies on sort of the environmental tension. And that's something that I've learned to be very, I guess, perceptive in kind of figuring out because it can make it kind of uncomfortable if, there's a vibe in the room and you're doing your job and you're not really picking up on it. And there's kind of this wall between, client and you or, the family and the client and everything else. So, but usually I'll have, for me at least right now, and I'm not full time right now. So
Okay.
usually I'll have about 3 or 4 clients a day. Um,
Mhm.
and that's kind of where I'm at because I'm very busy with a bunch of other stuff right now. So I think it's a good balance that I have right now, and I'm rolling with it. So
Do you
usually about
know
that.
Oh, sorry.
Oh no, you go ahead.
Do you know like what it would look like for clientele if you were full time out of curiosity?
It would be probably about, let's see, probably, well, anywhere from like 4 to 5 clients a day. Um, one day might be like if you load up. One day might be 3 days. I know my roommate who also does skills work. She was full time for a while, and she would do shorter sessions, so about an hour, and then she would stack those. So she technically had more of a caseload, but she had less time with each of those clients. I tend to structure myself in terms of, even though I have a smaller client list, right? I try and stretch those times out. So instead of seeing them 1 hour 3 times a week, which for some clients I do have to do that, but
Mhm.
really I like to have longer sessions because there's something that happens when you're there for a longer period of time, um, that kind of break. I don't know how to explain it, but it's just different because I've had sessions for an hour, and then I've had 2 like almost 2 hour sessions, right? And the almost 2 hour sessions are usually like way more productive because sometimes it takes a while,
Mhm.
right, to get through. So um,
So
that's
like
usually
on average, how long do you think you stay?
anywhere from probably like an hour and a half to 2 hours. That's
Okay.
usually about where I am, for kind of each session.
And
It'll
I
kind of
No, you go.
sure, it'll kind of depend too on like, so if I, for instance, see siblings, right? I'll be there for 2 hours, but each hour is with each client. So
Okay.
um, yeah, that's kind of how that's set up. And I travel to their homes. I should actually make that clear. I'm an outpatient skills worker, so um,
So they don't
I
come
have
into the office. You
no.
and some of them though, I know for a fact that you go into the school where they go to school.
Yes, that's another option. A lot of that's due to just parent availability and then also just distance, like travel.
Right.
Um, if I can't drive 40 minutes, right? um, that's going to be the most effective way so that they can still get skills in a good environment.
Right.
So,
And well, what's different about us, like you and I, Greta, is that we live in such a rural area that, like, if you were to go to, I'm thinking of one client in particular, obviously I'm not going to say, but I know for
mhm.
a fact if you were to drive from the office to their house, it would take like 40 minutes. And right? Like for you to just go to their school, it's just such a shorter amount of time. So that's where it's
Yeah.
kind of like a skills worker has to decide, okay, what's the best environment to meet them in? Are we going to meet them in the office, or are we going to
Right.
meet them in the school or their house? And then sometimes could you meet them, like, let's say, like go to the mall or go to a park, like when it's not
Yes.
winter?
Yeah. So in the summertime or warmer time, right? It's a lot easier to do that kind of stuff
Hmm.
because most of the time you just don't want to leave the house. But
Yeah.
yeah, like most of the time I prefer to do a lot of like walking because I don't know. Personally, I feel like driving a bunch of places with a client, like yeah, it's important and things, but I think for a lot of the time that like ability to kind of use the resources that they have around them is really important and not just like, constantly leaving.
Hmm.
um and getting out all the time and seeing like, oh, I have this down the street that we can walk to, right? Like this is a resource we can use, especially for little kids. It's like, oh, yeah, maybe you can ask mom to go on a walk and take you to the park sometime. So a lot more outdoor activities for sure in the summertime, warmer months,
Yeah. And
for
could you
sure.
give more like specific examples, like maybe like one or two of what you do with a person? Like, let's say, like in all environments, like one in the community, one in like in the school, in their house, and then like if you go take them outside, what do you do? Like, could you
Yeah,
just give a
so
specific example?
I usually have kind of a, I want to say like a system down. But like I said, when I before I even leave the house, I usually kind of have to plan ahead
Mm-hmm.
and think about like what do I need to bring with me. I have like this small kind of plastic tub of just stuff that I have for sessions only, and then I have like a bag that I, put stuff in. So if I know, I'll know what clients I have, I can kind of pick and choose what I think they'll kind of enjoy, or like I'll, grab something from the office or something. But um in terms of like for an in-home session, um honestly, it'll really just depend on the client, like knowing what games they like. um Maybe they wanted to do this activity, like if they like coloring. um I'll try and kind of have like some worksheets that I do with them. So in-home sessions are a lot more, I would say, like internally focused work. Whereas like, when we go outside and things, right? It'll be maybe we'll go to the park and we'll pass a ball, and we do a skill while we're passing a ball, like breathing or something, right?
Okay. Yep.
Um, or, if we're in the community, it might be, hey, let's ask the someone in the store a question, working on a social skill, right?
Yep.
Um, it could be making a list of things, organizing what you need to do. Um, I think those are just some examples. I think it's kind of hard for me to like deduce because I do so many different things with with so many different people.
Oh, I'm
Um,
sure. It's definitely not cookie cutter is what I'm hearing. It's definitely like it's going to be dependent on the client. It's going to be dependent on the environment, especially if you have some dog that's barking or you're scared it's going to bite you or there's multiple kids in the home or like the parents are home while the kid is home because like they aren't old enough to be alone and so like do the parents interrupt a lot? Do they not? Like all of those types of dynamics.
yeah, there's definitely a lot of moving parts. But I think, like I mentioned earlier, I'm pretty comfortable with the moving parts, so it makes it exciting.
Well,
It's what makes it makes every session just a little more exciting, and I enjoy that.
I think that's what's just so important about our work is that every single day, I think that's why I like my job so much on like out of all the reasons I do, like this is just another one is that it's not going to be the same thing every single day. It's always going
Right,
to be and you have to be adaptive and have to
right,
let go with okay, I have this plan in place. This is what we're going to work on. Like,
yep,
sometimes stuff hits the fan and you can't be like that and you have to
right.
just go with the flow.
Yeah, adapting is definitely difficult for some people. I know.
Mhm. Mhm.
And again, like every practitioner, every like it's different, and I'm sure you know too, Jenny. Like everybody's different in the way that they operate things and I
Yep.
guess handle situations, and I think that's what makes it so unique too. Because if a relationship with a client clearly isn't going well, sometimes it's, you can't take it personally. It's just like, all right, my personality, my way of doing things, it's just not clicking, right? And I think it's interesting too, like kind of the acceptance and the flux of like, learning more, especially like in a therapeutic environment of like, if there's not a fit, it's okay to be like, would anyone mind, like considering this person and think they would work better with them, right?
Yep.
Um, and there's no judgment or really any fear about that, which I think is really good. I think it would be weird if it wasn't. So that's been definitely reassuring, something that I've kind of been learning a little bit.
Yeah,
Um,
yeah.
but
It takes a while to really like, especially if you already come with, for myself, like I already have a lot of anxiety and like the anxious attachment as you learn about yourself going through like the counseling
right,
education, and it's like, man, like that's an attachment wound that I need to work on, and that you have
right,
to separate yourself from like it being your fault and it just being a personality difference. And that just comes down to like literally everybody is not going to like you. That's
yep,
just
yep. I do think it helps too because my family's basically from all out east, and so as most people know, is that culture is very much say it to your face, like no hurt feelings. It's just what it is.
right.
Um,
And us living in the Midwest, it's super passive aggressive.
right. So I feel like I've at least had some priming in my life for, for those situations to kind of come up. So I love feedback. I love being, talking about stuff. Yeah, but I know what you mean because it's still, as much as you want to kind of be like, oh, it's fine. It's like, no, there's always a human part of you that's like, well, wait a minute. Did I do something wrong?
Exactly. And
Yeah,
and I think it's still good to ask that question, but also understanding that sometimes it just does come down to it not
right.
being you. So when
Yep.
we talk about skills, and we're talking about really basic skills, what are some skills that you think you most often like come into having to work with your clients?
I mean, it seems pretty obvious, maybe just to me though, but
I think just to
breathing.
you, because I genuinely, I'm very curious.
Breathing, I think, is the biggest one. Um, I remember I had a one of my music teachers. She always used to tell us, like, before we start anything, like before we even move to start our piece, like we have to breathe. And she was
Mm,
always like, don't breathe, you die. And like, obviously I don't say that to clients, but in my head, right, it's like that's kind of how I think about it. And I can usually tell when someone there's just this tension, right? And it's so easy to forget how to breathe. Like
yeah.
the minute we're born, we have this automatic reflex to cry. And like we have to breathe to cry, right? Like we're just supposed to do it naturally. And I think over time when we get all this tension and all this external stuff, it's like we forget how to function. Like it can
It's
get
so true.
so breathing is definitely a skill that you hear all the time, but seriously, like that's 10 like 10 out of all the skills like you need to like that has to be high priority.
So that would be
Uh
number one. What would be, like two or three?
um Second, I think is at least for what I have is, task completion and organization. I think those are two kind of big skill areas. Like physically organizing your life
Mm,
and using that sort of as a reflection of internal order. Um, it's always the thing of like make your bed, right? And you'll start your day a lot better. And I do kind of believe that. I'm not a bed maker kind of person, but um, I feel like I'm pretty organized. So maybe I'm the exception. I don't know, but just organizing general things, right? Like maybe it's doing your dishes more regularly. Maybe it's, you wipe the counter every day, like, picking small things. Or I guess for kids, it's maybe when I get home from school, I put my homework away in this one spot, or like I unpack my lunch, or, little things like that. So a lot of like task completion and organization. Um, is definitely a big one. So that'd be
Yeah.
like two, three. Try to think of what else. I
I was
think,
kind of surprised I didn't hear communication as one. Like,
um, yeah, I mean, communicate. Well, I would say for I think that was that last part. I was just thinking about that too. The asking questions in conversation and also being able to stay on topic
yeah. Yep.
is in terms of like communication skill wise, I think that those are the two biggest things. Like, um, and I've often wondered, especially with, you know, in our age of chaos, having all these different things demand our attention at once. If you go on TikTok, right, like it's so much attention that we have to have and all these different things going on
Hmm.
that I think that's kind of made it a little hard, but engaging in like a lot of those active listening skills and things
Right. Right.
would be a big one too. So, yeah.
Okay. So because you do in-home work, I am so very curious about what was it like for you the very first time you went into somebody's home. And I ask this because, somebody might be hearing this and being like, "Oh my God, you went into somebody's home? That's so dangerous. Like so many things could happen to you. What does it even look like?" So I I'm curious, like, what were some of the thoughts that like
Yeah.
were going through your head? Like, how was it when you first walked in? All of those types of things. How were you feeling?
Well, if I'm honest, um,
That's what I would like.
yep, to be expected. Um, when I first started shadowing, I think I had a few moments where I was like, man, do I really want to do this? Right.
Okay. Yep.
And
That's fair. That's fair.
being honest, and then when I got to where I am now and started with my new clients, right? Um, I actually felt a lot different about it.
Hmm.
And I don't know if it's because I was the one working with them. I don't know if that makes sense, but like it just felt a lot less weird to be in all these different people's homes and all this kind of stuff. And I think part of that too has to, is just work to the fact that like I'm seeing these people on a regular basis now. So
Hmm.
for me, they're not new homes anymore.
Yeah.
Um, but at first, it's definitely intimidating because it's like there's just so many different environments, so many different things going on in the home, and you can prepare as much as you want, but you really can't. If you're a real estate agent or you love, you know, watching HGTV and like all those different home things, like,
Yeah.
you will have a blast doing this job because seeing, I think, how everybody lives is just such a valuable, I think, lesson in not only just being humble, right? But also, um, I think just such a reflection on like who we are. Like the decorations you have in your home is kind
Mm.
of like certain things that you value, and everyone values different things and how the things affect the things, right? So um, there's definitely a little like hesitation there, but I think my I should mention my parents for the last few years have worked on estate homes. So my dad does real estate, and then my mom kind of helps set up the sales and things. And helping with those sales, like during the summertime, has definitely got me a lot more comfortable too with just like the changing environments and being different places all the time. And um, I don't know, it's just really fascinating, and it doesn't bother me anymore. I think you just kind of got to do it. Um, yeah, and also I think too setting up boundaries when you get in the home, like asking clients, right? Like, where do you want me to sit or where do you want me to
Mm.
stand? You know, kind of defining more of what they're comfortable with. Um, and then also too for yourself, like there'll be times where there's really nowhere that you'll feel comfortable sitting. Maybe like one chair, or especially in the wintertime, it's hard because you can't unless you drive somewhere, right? Like you're in the home. So um, establishing boundaries of not only what you're comfortable with, but then also what client is comfortable with. So I think setting up boundaries is definitely like a huge chunk of that for sure.
Is there anything that like you for yourself or the company that you work for that you're like absolutely I do not do this while I'm in the home or like eating their food or I don't know.
Yeah, so one of the biggest things, and this is just kind of a so I when I first started, I like went over, and I know some people don't do this, but I like went over policy stuff like ASAP because I was like, I
Okay.
don't want it to happen. You know what I mean? Like I was kind of just paranoid about it. And part of like how I explain it and kind of how I've explained it to clients, because like, there'll be times where they're like, oh, do you want this to eat? Right.
Hmm.
And I'm like, no, like I can't, right? Because my resource to them is my like behavioral guidance and
Right.
service, right?
Right.
So taking any resources that are around them, like that's a no. So when I say like where can I sit, it's quite literally like where am I allowed to touch, right? Like I can't
Okay.
if they're like, "Oh, can you run up to my room and grab this thing?" I have to have them go with me at least the first time, right?
Hmm.
Because I can't just go in their room and try and rummage in their stuff. Because what if something goes missing? Oh, well, the skills worker was up there,
Right. Right.
right? And then that comes back on me. So that's kind of how I've always, thought about it. Is it's like I'm not a home organizer, I'm not a cleaner. I'm there to guide them, right? To get to that place where they can do it themselves. Um, and so I've kind of operated in that way. And like obviously, I'll help here and there when there needs to be things, but definitely that like setting of boundaries. Um, because I'm definitely more, and I've actually seen a lot of benefit in just not getting too involved in their environment and
Hmm.
kind of letting them do it themselves. Um, and being very comfortable with confrontation. And most of the time it gets taken pretty well. So if you call, typically if you call somebody out on something, they'll be like, oh yeah. So um, that's kind of where I am with boundaries and things. I know sometimes like if a family's eating dinner, like just bring your own food. That's pretty common.
Hmm.
You eat with them, just bring your own food. That's I haven't done that personally, but um, I also haven't had a family eat dinner yet when I'm there. So
Yeah.
uh,
Yeah. Yeah. I know. I think that's such a really good piece to know is that how powerful boundaries are because
mhm.
one, you have clients who like to test those, and two, like it gets you out of like really sticky or icky situations where you're like, oh God, what do I do? What do I do here?
Yeah,
What's protocol?
yeah, yeah, yeah. Especially when it comes to pets, because that's actually another one. Like, it's definitely up to the person's discretion, but generally, right? Like, it's better to not engage too much because if you get bit by somebody's pet, it could be something like you don't really know. Are they vaccinated? Like, are they up to date on their stuff, right? And then
Okay.
it's like,
Yeah. Yeah.
well,
I didn't even think of
I get
that.
infected. Like, oops.
Right.
Like I can't blame client because I was the one who was engaged. Of course, if you get attacked or something, that's a different story. But and I haven't had anything like that happen, so I'm good so far. But
No, I just had it was like a few weeks ago, some kid in the office had like hit his head on like this like desk that we have right before the bathroom, and I know Greta, you know what I'm talking about. And he
yes,
smacked his head on it and his nose started bleeding everywhere and there's blood everywhere. And I'm like, I had to get
oh
to the mom because I'm like, I'm sorry, but I'm not gonna touch blood. Like that's just my own boundary. Like
yep, yep,
unless obviously you have gloves or whatever. But yeah, like
right,
those just weird, odd, like out of the blue things, they do happen. As much as you say, oh, that will never happen, they do.
they do, yeah, yep, and it's kind of awkward because sometimes it'll make client a little upset, right? But then if you explain it to them, it's like, oh, that makes actually a lot of sense. Like
Right.
like I would
Absolutely.
do that either. So usually if you just explain it and it barely takes even a second, you'll just say one thing and they're like, oh, I get it. Okay. So um
And I know I mean, this, if we're going to talk about boundaries just a little bit longer, I know, so Greta, I don't know if you know this, but pre-COVID, therapists having their clients have our cell numbers, like even if it was just like a Google number, it was unheard of. It was like, no, you never ever give a client like your cell number or even just a fake cell number. They have to call the office. And for
Right.
obviously like a skills worker, you're on the road, you're going to their house, you have to have a cell number.
Yeah.
It's just, it's always been that way. So how do you keep boundaries with communication in that way for yourself?
Yeah. Um, so we, um, and I guess but it's kind of protocol, but use Google Voice.
I do
So
too.
yep. Yeah. So that's been pretty good, and I like picked one that's like completely different from my number, so there's no potential crossover. Um, and I honestly haven't really had any issues for it. I
Mm-hmm.
usually I tell clients is so it kind of depends. Because there's a setting you can put on for like do not disturb or whatever, right? And then you can like turn it off when you actually start working.
Mm-hmm.
Personally, I tend to leave mine on because it could be like, I don't know, like Sunday morning and something comes up for a client and that wouldn't be considered a late cancel. But if I had that on, didn't turn it on, then I would have to, you know what I mean? That would be considered then a late cancel, even though it's like not. You know what I mean? So
Yeah, I do.
there's all this stuff where it's like I personally would rather be more available for like especially for parents. Like I don't communicate at all with any of the kids. I only communicate with their parent.
Mm-hmm.
And generally, we only communicate for like, oh, I need to start session a few minutes late today because so and so is sick for something, right? Um or can we talk about a treatment plan? Do you have time to call? That's a majority of what our communication basis is. We can't do, and I think that it's a recent change actually, but skills workers cannot work through telehealth, um, which is honestly kind of a huge barrier. um, and I guess that happened like right after COVID, but
Yeah,
um,
it's, I
it's
was
definitely,
told that it was because the peacetime ordered. That's what I was told.
yeah, I have no idea, but I mean, I'll tell you, and when the winter is awful, right? Or a kid's super sick, but they're not like sick enough to. Do you know what I mean? Like, there's just
Oh,
some things where,
absolutely.
like, yeah, I want to be at their home, but like, does that mean we have to completely cancel a session because I can't physically be there, right?
Because the
So,
weather is poop. Yeah, I know.
yeah, there's some disadvantages to that, but um, it's not a reason, obviously, not to not to do the job or anything. So that's just one thing I think that'd be good for people to know too. Is like, yeah, at least where we are,
Yeah.
skills workers.
I don't know how it is in other states right now. It's something I need to look into more because I'd be very curious about that. Um, so one question I also had for you, Greta, was, what do you know now about being a skills worker that you wish you would have known before even becoming one?
I mean, I think it comes back to that whole point of like boundaries, right? Like I think and even seeing like how figuring out how I do things and not feeling like so much pressure to be like another provider. Um, whether it be just format of how sessions are organized and things like that, right? Like knowing that like it doesn't have to be an exact format, like you can actually figure out what works for you and your client, right?
Yeah.
And I think the flexibility component is something that like that independence has been really nice.
Hmm.
Um because I'm, had a lot of jobs where most of the time it's like you have this schedule, right? And you have this thing and you have to follow it. So it's just kind of nice to be like, wow, like I have all the tools in my toolkit and I can use them however I want to help fix the situation. Like that's just such an awesome thing that I definitely did not know beforehand. And like I think even like I said earlier, like even knowing skills work exists is like 95% of that learning experience that I've had for sure.
Yeah, absolutely.
So
I think a lot of people when they shadow, so like when they obviously we're not going to throw you in with the wolves and just be like, all right, here you go, you know your job, just do it, right? Like you're going to shadow somebody, learn how to do it. And then you find yourself often like I did even myself when I would shadow with other therapists is like, oh, like this is how I should be, or I need to model what they're doing to be the best therapist I can be. And that's really not true. Your personality can show through and your individuality and things that you know are just like, this is just who I am. This is how I'm going to play into this. Like for
Right.
me, I like to make a lot of jokes. You know, I like to be kind of charismatic in that way. And other therapists are very much more serious. And that's okay. Neither of them are right or wrong. It's just different.
Right. Yeah, and I think that's kind of what I meant too by like that flexibility of like having your toolkit and knowing the different approaches and things like um even when I was shadowing too, it's like there were certain things, right, where you're like, "Oh, I didn't think about that. That's a good thing." And then there's certain things where it's like, nope, that's not me."
Yeah. And
And it's
that's okay.
like it works for them and their client, and that's great, but that's just not my personality.
Yeah.
Um, so I think too, it's kind of a like a finding yourself type thing a
Hmm.
little bit too,
Yeah.
feeling a little confident and like, nope, this is who I am and what I like to do, and being okay with that for sure.
So if we were to talk about, you know, you said that the environment is ever changing and we think
Mhm.
about, you know, severe and persistent mental illness, do you think there's ever a time where you go in the home might be very clean or spotless, and then the next time you come in it's like super disorganized and chaotic?
For sure. That's twice a week for me. That's pretty much what it is. I most of the homes I actually see are quite nice, so I
Hmm.
can't complain. But I do think that it has always interested me too. Um, just you know, seeing how it's like a home could be clean and organized, right?
Hmm.
Especially if you're working with a kid, and then you walk into their room and it's like a tornado. So it's like seeing some of that contrast too of like walking into a nice space and having an expectation and that's different and think going I think it's all about just that preparedness of like preparing yourself for kind of what kind of expect the best but prepare for the worst type thing.
Hmm. Like mentally
Um
kind of hype yourself up.
yeah, like all right, let's do this. Especially for the houses that are a little rougher. And coming prepared to like, having a scarf and or like putting Vicks Vapor Rub under your nose, like if it smells, like there's just
Hmm.
things you have to do. Like I specifically have like work only clothes that I wear.
Oh, I didn't know
Uh,
that.
so I only wear certain work clothes because when I come back, I smell like everyone I just went to.
Oh, I never
um,
yeah, I never thought of that piece.
Like, I have a client who vapes a ton and
Hmm.
occasionally will smoke weed. So guess what? I smell like that when I leave.
Right. And if you
Or
come in the office, we're gonna be like, Greta, what's going on? And you know what's
yeah,
so funny is like after case consultation, like it was like a few weeks ago, I thought I smelled weed too. And I was like,
yeah, that's probably what it was. I because I think it's so interesting how like, and I've known this too because I've had one of my other places that I used to work at had a lot of like perfume in the store,
okay.
and the time I got home, it just like drove me nuts. So
Right.
I've like learned over, and then I did like another one in landscaping. So like the idea of having like work only clothes has just always been a thing for me. So there's just something so nice about like when you take off those like work clothes and put like it feels like your clothes almost, right? It's like you smell like yourself, you're clean, it's really nice. And it creates another separation between like not bringing home work.
Oh yeah, absolutely.
I think that's another thing because it's one thing to have like and I thought about this too actually, right? Like to have your own office,
Hmm.
it's kind of like your space,
It
and you're
oh
allowed to
yeah.
come in and out of your space, right? But you're going into someone else's space, so like it's hard to not get lost in kind of your own your own environment, right? So
Oh
I
yeah.
think
I mean, I'm super protective of my office. Like my office is my space. You know what I mean? Like it's like my space to just chill, be calm, whatever. And if I go into anybody else's office, it's like that's a reflection of their space.
right, which is also kind of why I'm a little excited to have my office someday.
Yes. Yeah.
Have like
Mhm.
MySpace, but yeah, I think definitely like creating a ton of boundaries. It's all about boundaries today. For like even how I organize my life so that I'm not bringing stuff home. Um and I think even from like a general cleanliness standpoint, like you don't really know what's an environment and like if somebody's sick in the house,
Mhm.
sounds kind of crazy and like, I'm not OCD, but you almost have to kind of be a little bit of like, I need to get home and I need to like clean, just quick take a Clorox wipe and wipe the bottoms of my shoes just to make sure I'm not bringing anything in, right?
Hmm.
Um so there's some things like that, or like making sure to wash your hands like after, a session or whatever if you've been touching stuff.
Mhm.
Um because it's really easy. Like, there's been a lot of times where I've gone into homes and like everyone's coughing, right? And I'm like, well, all right, I'm taking a risk here, and I'm fine usually, right? Um, but I think it just comes down to that like kind of organization bit of planning around certain things and being able to kind of decompress. I think is really important. So
Yeah, and I think those are really, really great tips for anybody who would be thinking about getting into this. Those are really good things to be thinking about. And we're not saying, that it's horrible, right? Oh, like we're judging our clients for
no,
having this type of home or smelling like this. We're never judging. It's more how do we create boundaries for ourselves and make sure that we're protected as workers, and how do we also attend to our clients so that we can be fully present rather than distracted about, oh, like the smell is bothering my senses or whatever, right?
yeah, I think
And
that's the big thing too. Is like you are there for the client. Like the client, you know what I mean? Like you were there for them. You're doing them a
mhm,
service. Right? And so like giving, yeah, like you just said, like giving them your full attention
mhm,
and not being judging is like 100% of that component, right? But then also taking care of yourself is, just finding that balance, but not being like rude about anything.
absolutely, absolutely. And on top of that, I just want to say, like, their environment is also a reflection of their mental health and where their
Right.
state of mind is that week or
Right.
that day or that month.
Yep.
So
For sure.
sometimes even
Yeah.
that year.
Yep.
So, is there anything else? Because I'm looking at my own notes, and I think we've covered so much. I just kind of want to wrap up with talking about you and your next goals and
Sure.
going to grad school. Is there anything else about skills work that you want to touch on that we missed?
I'm trying to think. I did want to actually go into art therapy for a little bit when I was in my undergrad.
Hmm.
Um, and I decided not to.
Okay.
Um, but at the same time, I've noticed that for skills work in particular, and I'm sure any providers listening probably understand this, but art in general during any kind of session is amazing.
Yeah,
Um,
for real.
something I use, like, I have a whole binder of just coloring pages that I bring to sessions,
That's awesome.
and we'll like flip through them, and they're so excited. Like, all right, what are we gonna color this week? And like taking little breaks to color, or like paint, even, or like do crafts or anything like that. Like, I think those are just really, I don't know, something I, in terms of skills work, was really not sure how I would implement, but I think now it's definitely become a standard part of my practice. I would say for now. So
I don't know
that,
if you know this about me, but before I became a therapist, my bachelor's actually is in K through 12 art education. And it wasn't until I got my master's degree in counseling that they were like, okay, you have to go through a whole separate degree to become an art therapist than a mental health
yeah,
counselor. And I didn't know that. So, like, obviously then it would just be art and therapy. So I don't think there's anything wrong if you don't go the art therapy route, because you can still, you can't, obviously interpret the artwork, but you can still use art as an assistance. And I do myself see such benefits. Like I did a whole diamond painting with one of my clients. So I think it's great that that they are so excited and that you have this whole binder of like coloring pages. That sounds amazing.
Yeah. I definitely encourage anyone get get art supplies if you can. It's just great to have. And I think even for yourself too, like especially for some of those people who have a hard time with eye contact,
Mhm.
it can be really beneficial, right? Because if you're doing it with them, like if you're coloring while they're coloring, and like we're in the process of completing a task, number one, right? So if that completing a task skill is on there, we're completing a task. And sometimes it's interesting because the ones that struggle sometimes don't always end up finishing it or even get near finishing it because they're so distracted, right? So
Yeah.
using that as a skills thing can be really helpful. But I think also too, just like on a communication basis, right? Like, um, it can be kind of hard to get through someone, especially if they're really intimidated by that eye contact pressure. And it's, I like to think of it like, when you're driving in a car as a kid and you're in the back seat and like you kind of just talk all the time
Mhm.
because mom's not looking, right? Right? Like it's just, it feels less intimidating. So, um, yeah, art, I'm a huge proponent of. So if you can use it, use it. That's my, yeah.
So what you are going to go for a mental health counseling masters, or what's your plan right now?
Yeah. That's my plan. So, I'm looking at a few different states right now, which of course, their licensing requirements are different, but
Yep.
just mental health counseling. That's
Okay.
kind of what I'm looking
And
so.
I'm sure with cuz like the degree that I got for mental health counseling, you could either go the LPCC or LMFT route.
Right.
So I would assume, and maybe I'm wrong, but I would assume that it would be similar in other states, that you could go for either or, as long as you have that family therapy classes under your belt,
Yeah.
which most programs do anyways.
Right. They usually have, from what I've been looking at anyways, they usually have like two options. So they'll have like one licensing option, which is like the main one, and then they'll usually provide an alternative, which is nice because if you're moving states or whatever, right? Like you have to, I mean, obviously you have to make sure that your license applies to that other state, but um, generally most of them are kind of about the same. So,
Yep.
and even if you have to take like one class, it's one class.
Right. It's usually
So,
not that big of a deal. So are
yeah.
you already like you've applied and now you're just waiting to hear back?
Yeah, I have two interviews set up and I'm waiting for just a few more to hear back. So,
Okay.
it's exciting.
What made you like when did you even know that you wanted to be a therapist?
Oh, a long time ago. um, I had a lot of kind of intense personal experiences as a kid, and I think just working with people my whole life and really enjoying just kind of being a listener, I think is something
Mhm.
that, like, I don't know, I just really enjoyed. I know some friends kind of complain about that, where it's like, oh, I listen to people all the time, right? But I think for me, it's, I don't know, I find people so fascinating, and I think that's
Yeah.
like 95% of my interest is just I just want to know how your head works. I don't care what you got going on. Like, I just want to know what's going on inside of your head. Good, bad, whatever, no judgment. I'm just curious. And
Mhm.
so, I think I've known for a long time. And I wanted to go into education too. I wanted to be an art teacher for a while. And after, getting some experience in the school system and whatnot, I kind of moved out of that because I was like, I don't feel like I'm doing enough of what I actually want to do, right?
Yeah.
Like,
Yep.
I can only get so close to these kids, you know, emotionally and working with parents before I can't really do much.
Right. It's out
Um,
of your competency at that point being just
right,
a teacher, you know. That's just
right. And so I think,
limitations.
right. And so I think with like my interest in my, personal experience and just even like skill set, I think it's always been something that I've just felt like, and I feel like most practitioners say that, but like it's just something that you just kind of knew is like, yep, like this is it, and you have to know because I've I've talked to some people who were like, oh yeah, I probably want to do it, whatever, and then when you start talking to them a little more about stuff and kind of like the process, then it's like, nah, I don't care about it that much. Or
Right,
like, I don't
right.
know if I could do that. And well, how can you handle that? Blah blah blah. And it's like, I don't know. I just like it.
Right. And
So
then you also on top of it, you find your niche. What do you want your specialty to be in, or what are your interest areas or research areas? Like you slowly develop that over time as well. And that in itself becomes so fascinating and furthers, how you are going to interact with your people.
exactly. Exactly. Yeah.
Okay. Well, when do you think when is your interviews then? Or when do they
I
start? What month?
I have one next week.
Oh,
So
next week. Early as next week. Are you nervous? How are you feeling?
um so I actually applied to school last year. There was a huge debacle. I got in, but it was kind of sketchy because they couldn't provide me like any information.
Hmm.
And that's another thing I would tell people if you have not already applied to grad school. Um, Ask for the financial information up front,
Yeah.
like general tuition costs, scholarship opportunities. Because what happened to me was they accepted me and then they couldn't tell me what tuition would cost or like any of that estimation until I accepted. Uh,
Oh my God. Wow.
so yeah, so they made it seem like, oh, you're just a special student, whatever. And I was like, okay, but you're
Hmm.
not telling me anything. So so anyways, so I've had an interview before and I've always felt pretty comfortable with them. So I'm honestly not too worried. I feel like I've gotten a lot of experience this last year actually. So I don't know. I'm more prepared than I was, and that's honestly the best I could hope for. So
Yeah. Yeah. Because remind me, when you have a psychology so when you get a degree in psychology with a bachelor's, do you
mhm.
have typically, is it like required that you have to do an internship or anything where you're actually outside working with the people?
It is not.
So just that, right? Like, just
Yep.
that tells me how monumental this experience of you being a skills worker has like
Yep.
made you grow and experience things that you wouldn't have normally
Mhm.
and is really going to carry you so far.
I was honestly so excited when I started. Like it was, it was kind of intimidating, right?
Oh,
Like there's a
absolutely.
thing that's like you're not from like even licensing or like going to get your fingerprints done. Like there's just
Mhm.
like basic things you have to do that it's like it's kind of scary, right? So even getting comfortable with the process of like how to report to DHS or like just a lot of basic things that like I think as a bachelor like you don't get taught that.
Yeah.
Like
You don't get that
those
experience, like literal
no
hands-on experience.
no. And when I started teaching right after I graduated, and then I transitioned over to where I am now. And
Mhm.
um, I think that was that thing too of like I had worked with some parents who had kids with IEPs, and um, I think it's like you just said, like I got to a point where I was like, all right, I'm going around what I want to get to, right? Like I need to just do it. So, um, there's just yeah, I'm so excited. I'm so glad I have this opportunity. And I'd say like especially for anybody who's going into um grad school or anything like that, like if you can find skills work opportunities, I would take it because
Mhm.
even before like going to grad school, I think for me it confirmed that I'm able to take on that challenge, right? But I could totally see how somebody just coming straight out of, undergrad for psychology and going right into grad school and not having any of that experience, like it
Yeah.
would stink to start getting your degree and go into your first practicum and realize like, oh, I can't handle this. And that's okay. That's totally fine. But like I'd say it's better to just know for sure before you start getting your degree and stuff.
I would say it's
Just
more like it could be more anxiety producing if you don't have some type of background in just working with people or mental illness or healthcare just because you know and I don't mean to sound pretentious when I say this, but when I applied for my master's, a lot of the people who got into my program we're coming from a psychology bachelor's, and for me, I came from, I was a teacher. I used to
Yeah.
substitute teach around the surrounding counties. And
Right.
for me, like, I had that like experience of like, okay, like, how do we talk to administration? How do we have a professional life outside of a
Yeah,
personal life? Like all
right.
of those just little moving parts, I feel like really helped me. Now,
Yeah.
does that make me better? No, I'm just saying that it helped me. Um, it helped assist me in not having all those anxieties. It helped assist me in the interview process. Those
Right.
types of things.
Yeah, it's that's I guess my that whole thing is like like as much as you can experience is
Hmm.
just so worth it.
And you
Like,
get networking possibilities along with it.
right. So like if you're, doing education stuff, if there's an opportunity for you to like what I did, like join psychology club, or like if they're like, to talk to people, to network, if there's a volunteer opportunity, right? Like
Hmm.
try and take advantage of that. If there's kind of a class that has something that's a little scary, like do it. Like I took a forensic class or a forensic psych class and we had a mock trial. It was
That
terrifying.
is cool. That is
but
cool.
but it taught me a ton about like the law process, right? Which is useful now. So there's just all this stuff where it's like if you can find even little experiences that aren't that hard to get,
Right.
just take them.
Yeah.
I think that's yeah,
Yeah.
not
Like
joking, but
the knowledge that you gain, the networking, the connections that you make, I mean, it's going to take you so far, and it's going to really help you um be able to assist you in your career. I know, like, me having to, like, I had to interview certain like therapists in my master's program, and just me having to be forced to like email surrounding therapists in the community and like interview them and talk to them, just me having that network and that face has helped me in my career now, because it's like, now if I'm like, oh, well, I know this therapist in the area who does this, or just
right,
that, just a little small thing has helped me in my own career today. So
right.
just those little things, I mean, they are going to help you in so many different ways.
Mhm. Yeah, go for it. In the simplest way, yeah, for sure.
Well, I wish the best of luck to you in your interviews. If there's anything I can do or assist you with, please let me know. I'm so excited for you, and you're going to have to let us know how that goes.
Yeah, I'm super excited. It's totally been like a whole year of flux, but
Mhm.
it's been, like, good. So, it's exciting.
Right.
I'm very excited. I'm not worried.
Good. You sound a little worried. I'm not gonna- But I'll believe you. Okay.
Well, I have a lot of, like, moving stuff to organize. That's where that's
Okay.
coming from.
Okay.
But everything else in terms of getting into school, I'm not worried
I'm
about that. So
confident that you will at least get into one of the places. How could you not? So is there anything else that we, didn't talk about, or anything that you want to just note before we end today?
Uh, I don't think so. I think we kind of covered everything. I'm just thinking like skills wise, if there's anything else that um oh, um that's another thing I think I mentioned earlier as a skills worker, working with the surrounding community,
Hmm.
right? So contacting like caseworkers and things like that. I would say like get really comfortable looking at like the DHS websites and like government websites and stuff.
Department of Human Services, by the way.
Yes, sorry, I should have clarified. Um, yeah, I would definitely like kind of get more comfortable looking at that sort of stuff and feeling comfortable like contacting
Yeah.
caseworkers,
Yeah.
um, and not being afraid to give them a call because it can be kind of intimidating because you're and it's like, oh, am I doing something wrong, whatever, and it's like, no,
Or even a
like,
probation officer, or like a
yeah,
lawyer that a client has, like those types of people. That can be super scary too.
yeah. So like even though you're not a therapist, like still contacting those people if you can be really helpful because especially in the beginning, like if there's something going on and you don't really have the full story, it can be really helpful to be like, you know, someone who's worked with them for 5 years be like, oh, hey, this is what I see, right?
Mm-hmm.
And I think that whole part of like hearing one person's truth and hearing the other person's truth on the same thing kind of gives you a much broader perspective.
Yeah.
So you can just be a lot more balanced and sort of figure things out. So, yeah, I would just say like getting comfortable communicating with the community um, is just that last piece that's super important for skills. So,
Absolutely. I agree. I agree completely. Because not every client that comes in is going to be okay with telling you their whole life story or where they're at. And sometimes while you're building that rapport, that relationship with them, you can search those outside sources, just like you said, Greta, and get more of the picture of what's going on. And you can pick and choose on what, you take and what you don't take, and you just kind of keep it in the back of your head.
yeah. And that's totally fine too. Like sometimes I think it's, you know, it's very understandable, I feel like, cuz I mean, especially if trying to put yourself in those that other person's shoes is just very valuable, right? So it's kind of like, well, if I was in this situation and I was really overwhelmed, like, am I really going to see things from the full perspective? Probably not.
Right.
So having more objective parties be involved can be really helpful in terms of not just you as the practitioner, but I think even like sharing some of that information with client being like, oh, yep. So like, here's some other observations we have, not being specific about who said what and all that, but
Mm-hmm.
I think can really help just build rapport too, of like, oh, they're actually willing to be involved with your situation, right? Like, oh wow, they actually contacted the caseworker to talk about my kid to make sure that they're getting to school on time or something like
Mm-hmm.
that would be really valuable. So
Yeah.
yeah.
Well, Greta, I really appreciate you taking the time out of your day to come on and talk about your experience as a skills worker and just kind of where you're at also in your own professional life. I think that's valuable to a lot of people who either don't know about skills or who are even a skills worker themselves right now. And just having these types of things just be in the back of their head, or even just validating and normalizing their experience as a
Mhm.
skills worker. Because I know, even as a therapist myself, often it's like you have that kind of imposter syndrome of like, oh, like, am I doing things right or am I not? Like, this is
Right.
what I'm thinking about. And I think it can be just super validating just sharing our experiences.
Yeah, I think the more we talk to the community and support each other, I think the better it is, especially because it's when you're doing something so independently, like it can feel isolating. And
Absolutely.
I think that's the one thing, especially like I've been very fortunate in that I started this position with someone who's already in it. So, especially in the beginning, it was like, wait, is this normal? Like, is this
Yeah.
like,
Yep.
is this a part of thing? Or even being like, wait, is this like the correct way to do something? Like, and then kind of having that confirmation of like, oh yeah, like that's totally fine. You can do it this
Hmm.
way. There's no restriction on that, and it's just really beneficial to just talk to people. I think that's communicating with everyone else, and I think even if someone is kind of in their own world, even just asking them a question, even other therapists too, if there's somebody who kind of knows skills work, like even just asking them about it, I think can be beneficial because there's nothing wrong with just asking, um,
Yeah.
and kind of back that way. So yeah.
Absolutely. Your skills work that you've been doing is really going to take you far as a therapist, because I'm going to tell you right now, even though I don't have that background, I could see how somebody who is a therapist who does have that background could rely on that when stuff hits the fan for the session, right? Like, you can pull that out in from your toolbox, because sometimes, I'm going to be honest, as a therapist, sometimes you have to do case management work, sometimes you have to put on the social worker hat, sometimes you have to put on the skills worker hat. There's a lot of hats that we have to put on.
Yeah.
So, it's going to take you far. It really is.
Well, I'm excited.
Thanks again, Greta. I really appreciate it.
Yeah, thank you. I'm really happy that you have this awesome podcast.
Yeah.
Props to you for all the work you do. Keep it up.
Well, I hope that is helpful for anybody who is listening still. And if you have any other information, definitely let us know.